The FDA gives the green light for the first at-home COVID-19 and flu test with no prescription. The agency says the test uses a nasal swab to deliver results in about 15 minutes. The agency says people ages 14 and up can take their own tests now, while those 2 years and older might need some adult supervision. Joining us to talk about this and our other health topics, it's Dr. Bill Hartman, the clinical trialist at UW Health. Doc, great to see you. All right, a 2-for-1 test. Who should take this?
Right. Anybody who's got symptoms. We're heading into respiratory virus season here. The symptoms are going to happen to a grand majority of us. We're going to want to know if we have the flu or if we have COVID. This is the first combination test that's been approved outside of emergency use. So it should really increase the convenience so that people can test it in the privacy of their own home.
We're so used to the COVID tests. You can get them free if you go online now. The government is just releasing a whole new batch. But why would I take the COVID test when now I can take this thing?
Well, you know, it depends. You'll have to pay for this one. The other ones obviously are free. These ones come from a private company called Helgen. And again, it is nice because it does give you more information than just the COVID test. It will give you information on whether or not you have influenza A or B, which are two of the most common flu viruses around. And so it really allows us to get a lot of information in a short period of time for a small price that can keep our families safe and allow us to get the treatment that we need if we need it.
Okay, so what happens? I got the cough, I got the respiratory symptoms. I'm like, oh man, I think I got COVID or the flu. I take the test and both come back negative. That's a possibility, right? That's
a possibility. And it really, with these tests, because of the sensitivity and specificity of them, if they come up positive, you're definitely a positive. But if it comes up negative, there's always the chance that you might still be positive. So after a couple of days, if you if you've taken a negative test, you still have symptoms, you either take another test or you can go to the hospital or urgent care to get a confirmatory test.
It does seem like a big step forward, though. I'm ready for the test where you just take it and it tells you 1,000 things that could be wrong with you. So hopefully one day in the future we'll have one of those. Hey, speaking of COVID, a new study says it can increase our risk for stroke or heart attacks. What did this study find?
I think this is something that we all expected. Usually after any virus, we have an increased risk of having a heart attack or a stroke because of the inflammatory process that occurs. And we all know that COVID does cause inflammation within the endothelial cells, which makes you more susceptible to these things. I think that the more surprising part of this study is that the incident or the risk of developing a heart attack or stroke after COVID is about 3 years right now. That risk stays high for 3 years. Typically, after a virus, this risk goes away in just a couple of months. And so the fact that it stays elevated for so long really is something that is outside the norm.
That's wild to me. And I was reading like your blood type might actually even play a factor.
Right. The study went a little bit further to look at factors like that, and they found that non-O blood types were more susceptible to heart attack and stroke after a COVID infection than people with type O blood, but that the risk could be attenuated if you took a baby aspirin.
Interesting there. Hey, quickly, I only have a few seconds here, but new research, it just shows how connected our body is. Researchers say a healthy heart could be good for a healthy brain.
Right, kind of makes sense. It's, again, one of these things where we want to make sure that we have a healthy diet, we get plenty of exercise, we get the sleep we need, but we do all the things we have we can do to really have a healthy lifestyle. And having a healthy lifestyle leads to a healthy heart, which in turn will lead to a healthy brain, less risk of dementia later in life.
Get your veggies, do your exercise. Dr. Bill Hartman, appreciate your time.